quieted down so quickly. I'm used to my students, I have to wait a while. Welcome to our panel discussion related to the topic of HERE. I am going to briefly go through our agenda today and get to the questions because you submitted many questions, so we want to have enough time to get to all of them. Today we are going to field the questions that you had handed in for about the first 40 to 45 minutes. And then you can see that for the last 15 minutes, if you have questions that come up or things that you're curious about, an idea that gets sparked by our presentation, just jot it down. And Lisa Connolly's going to run around for us and field your questions at the end. You have the panelists' bios in front of you. We're going to briefly introduce ourselves, not as lengthy as the bios, and then we have students that are on the panel that are going to share their voice and their experience a little bit as well. I guess I should go first. Hopefully a lot of you know me. I am Kenan Krieger. I'm an associate professor here in psychology. I've been a licensed psychologist since 2006, working in the field since 1997. I worked at the Center for Human Growth, which we have here, and then at IU Counseling and Psychological Services as well.
Hi, I'm Leah Ketnes. I'm a psychiatrist. I work at Milestones, which is a division of Stonebelt. I always say that what I do is I help treat thought, mood, behavior concerns, and I see kids, teenagers, young adults, and anybody who has an intellectual disability or an autism spectrum disorder throughout the age span.
My name's Jim Wiltz, and I'm a licensed psychologist here in Indiana. And I guess that's about it. Oh, I'm also an adjunct instructor here. I teach psychology just upstairs on Tuesdays.
I'm Valerie Markley. I was a long time worked at Indiana University School of Nursing, and I am an adjunct at Indiana Wesleyan now. I've been in the Army. I was working at a maximum security prison, my last job, and now I'm going to be going to work in the nursing homes as an advanced practice nurse.
I'm Cypress. I'm a junior here at IB Tech. I study, well, not studying currently, but I'm going for game design and psychology. I plan to transfer. And I've been diagnosed with Asperger's and ADHD, two things that are argued at this point, but still. Yeah.
I'm Carrie Edmondson. I'm a full-time respiratory therapy student. Officially, I'm 24 days of school left. I started here in 2009 working toward this degree, and never been diagnosed with anything, but I'm pretty certain I have ADD. And suffer from a lot of test anxiety. Thankfully, I have two outstanding teachers, so appreciate that.
Well, wonderful. Thank you. I'm going to read the questions, and we're going to field the questions and take it from there. So, first question that someone submitted: what percentage of our students have undiagnosed mental health issues? I'm also going to bring in the second question. Which of the above listed mental health issues, I think referring to the title of the panel discussion, has the highest incidence among our students? I could do a whole presentation on answering those two questions. I did include some slides about what we know about our students from a study that was done a couple of years ago by the Center for Human Growth's Lynn Gilman. I think Sam DeWeese was involved with it as well. And this was a needs assessment study that was done on 655 of our students. Their average age, 30.27 years. 56.1% of those students had a likely presence of a mental disorder. When you look at community colleges as a whole, students at the community college level usually have elevated frequencies of psychological distress. And many of us know that that's usually because of the various factors that a community college student has that may be different from a four-year institution student. 59.3% of those students reported significant barriers as to why they wouldn't seek treatment. And again, these were our students. The two main reasons they said they wouldn't seek treatment were, and I quote, concerns about what others would think of them, and issues related to privacy. So while we can't directly comment on necessarily how many diagnosed students we have or what's necessarily the incidence rate. We do know that the student population that we have here, the rate of mental issues and psychological distress is higher than the average college student. Third question, which I will now go to the panel. Oh, you want to?
Can I-
Yeah, please.
When I think of mental health disorders and typical age of onset, for anxiety, ADHD, trauma-related disorders, the onset typically is in childhood, and what I mean by that is pre-adolescent. It doesn't always have to be that age by any means. In the 1800s and sort of the asylum days of mental health care, if you look at the number of individuals in an asylum who were children, who were pre-adolescent, it would be 1 in 1,000. It would be 13 in 100 in adolescence. That's 130 times different. And that has to do with bipolar disorder, schizophrenia, and depression having their onset much more often in teenagerhood. The other thing I always think about is what kind of stressors people are experiencing, and whether it's in their friendship life, in their relationship life with a dating partner, with their family, with school, their finances, and if you look at the time that is the most stressful, I would say, is when people have graduated or are out of high school and they're navigating the transition to in young adulthood. And so stress is a very big predictor of onset of mental health difficulties, or an exacerbation of underlying. Because by definition, most of the mental health disorders have to have impairment in how you do in school, or how you do in work, or how you manage your finances, or how you do in relationships. So to me, it's actually one of the most active times, and also one of the most difficult times too.
Thank you. I'll just keep going unless you want to stop me. So, okay. This one is for the panel. How can faculty members learn more about the appropriate way to respond in and out of the classroom to student mental health issues that disrupt the classroom?
Disruption can be very difficult to handle as an instructor. I'm sure many of you have students who you can think of who are like, oh wow, I had this one guy, or maybe 2 years ago, and it was so difficult to deal with that one person. And for me, what I think of is I think of kind of a balance, and you try to keep things balanced. It's very, very important. This person who's basically representing the disruption is probably going through some pretty serious stress. And the best way to deal with that, in my opinion, is really as little intervention as possible. And that doesn't mean just ignore it and let this person take over the classroom. I mean, really go through extra effort not to pull him aside in front of everybody. I had a recent example of this where I started by, he was very, very difficult. Luckily, at my first day of class, he stayed after because he really wanted to disrupt my trip home, right? And I was able, he came up and he had shared so many different things, including legal history, and I could tell by other people around him that some of the things that he was saying, he was not trying to be a bully in any way, but there were some people who all of a sudden went from, this guy's a disruption, to this guy's kind of scary. And I don't think he's really dangerous. I mean, if I thought he were dangerous, I would be, intervening on that. But he came up and he really sought some affirmation, like, I had these problems, and I really want to discuss them with you and make sure that that things are going okay. And I gave him a couple pointers, and I kind of said, well, how about this? You don't have to try to answer every single question. And I kind of left it at that. And I thought, well, what if that's kind of good enough? And I kind of had some rapport with him. And then the next class, he was seriously disruptive, so that didn't really help. But at the same time, I knew that I'd planted a seed, and I was building some rapport, and I realized I'm not a clinician with this guy, he's not at my clinic. But then I went to email, because I did know that he checked email, because he had sent me a couple. And so, I gave him a couple other things, and I said, I really appreciate your attendance. I appreciate the fact that you're paying attention, and you're listening, and you're trying. And I really think that what you need to do is start thinking about not being as disruptive. And I did actually use the word disruptive, and I said because it affects other people, and it's not just a class. This is not a dialogue between you and me during the class. And he responded very positively. And to this day, he still remains fairly disruptive. I have told him, but one of the things, it's much less. I mean, it's not obnoxious. It kind of went from obnoxious to being tolerable. And this kid has a right to an education. One of the things that I told him is, there are times that I'm going to basically cut you off, okay? And I need you to understand that I'm not trying to be rude, but at a certain point, I'm going to cut you off. And I'm just going to say, okay, that's enough about that. We're going to move on. And if it gets any more difficult, it'll be everybody has to raise hands for participation. I prefer not having that, and it's kind of working. But this is kind of it's an ongoing struggle. And every time I've had a student like this, I've tried to approach it by being very respectful of the student first. I know the other people have a right to an education also, but that's kind of the way that I handle it.
I'm curious about student experiences in the classroom in terms of ways that professors have approached you that have worked for you, if that's happened. Just to put you on the spot. Okay.
I don't know, am I a disruption? I'm not sure if I
Just
am.
between you and me.
You've had classmates that have been disruptions.
Yeah, no. Our teachers, I think they're really good about listening to everything that each student has to say or offer. When we all like to talk in my class especially. We like to talk about our clinic days, what goes on, what happens. So there has been a few times that, they've said, okay, Jennifer says, okay, we gotta stop, we gotta get going or we're behind. But I don't feel like we have anybody that's overly disruptive. But I do have a son that has ADD, and he was diagnosed in 2nd grade. He's getting ready to go in, be a freshman in August. And for him, he was a big disruption in class. And every year at parent-teacher conference, it was the same conversation over and over every year. And so I started doing a lot of research myself, just because I felt like Chase was getting that mark on his back, and I didn't want that for him. So one of the things that I took to his teachers was, just place your hand on their back. Just walk around, moving to the front of the room when you're giving out instructions. Place your hand on his back. Sometimes it's a physical touch to, calm them down or bring them to the level that you're wanting them to hear what you have to say. So maybe that's what I have to say. I'm not sure.
I know that I'm personally one of the more disruptive people in classes, but
That's not true, son.
of the people that I've been in classes with, I am probably one of the more disruptive people in said classes. I don't know exactly what would be a good solution for it directly. I try to, it depends on the class and how people react to it. If people ask me to be quiet, I probably will, but in the same sense, I don't know. I think it's person to person. It's not always about personal dilemma. Sometimes it's just about kind of like keeping a sweets jar just out of a child's reach. It's just hard to stop yourself if that's just kind of programmed into who you are. As far as that's concerned, though, I think that one of the best ways to be able to do that is person to person. But if someone is worried about something, other people will think about them. Use that. If someone's worried that people will start treating them like an outcast, tell them that this is disruptive and this may become a problem. But if someone is disruptive for other, if someone doesn't care about that as much or may take offense to that, then I don't think that would work the same way.
Thank you. This goes along with the next question. I feel like the beginning of this is a repeat, but the second part will address. How do we help the class deal with students who, because of social or mental disorders, are withdrawn or disruptive or have a tendency to monopolize class time? Obviously, we can't discuss the situation outright because of FERPA. Aside from modeling appropriate responses, how do we help the general student population cope and incorporate the student who is suffering from a disability. So this question is more about how we help the classmates in the classroom to be more inclusive.
I think one of the things about classes is that you're likely to meet up with some of these people again in the future, or people a lot like them. So it's a laboratory for learning to deal with people in the future. And I think if we help students, all students, to grasp that idea to some extent, and to think about the fact that they may be working with this individual or people like them in the future. And students who may ask, of course, I like having students ask questions, but if it gets too much, to, of course, direct, I'm sure you do this, and deflect to, Jane, what do you think about what John's saying? Trying to get other people to comment on the student's ideas, the student who's taking quite a lot of class time. I think that's useful. And always the idea of listening and kindness, to model that.
I think, oh, sorry, Jay. I think she has a really good point about modeling kindness. And part of it is, there's no question that you as the instructor, you're the person up in front, and let's say that you start, buying into the collective eye rolls, which we've all seen, I'm sure, and you're like, oh my gosh, if you start doing that, the whole class is going to basically take your lead and crucify the kid. And that's not appropriate. And fostering an inclusive way to include the person and say things like, that's a really good point, and say the guy's name or the woman's name, and then move on and call on people instead of just saying, does anybody have this? Well, if you say does anybody, it's does anybody. So if that's starting to become a problem, say, hey, I'm going to call on you right there, and know some student names out there on the first day so that you can do that.
One of the things I always say is ask for what you want. Don't tell people stop. Because if someone told you to stop interrupting, whether you have a mental health disorder or not, usually you want to do it, okay? So I think it's really useful to think about what it is you want to be seeing. And so if it's that you want thoughtful answers, or you want someone to be patient with other people in the class, or to be giving other people turns, it's a way to say it. People are much more likely to buy in and not be defensive, and they're much more likely to do it. So I think those things can be helpful. And obviously for the Golden Rule, we're talking a lot about validating how people are feeling, but a huge piece of social emotional health relates to this idea of attachment. And when you're feeling comfortable and secure and safe, and that pertains to the classroom as well. And so if people are feeling picked on or not heard or not validated, you're going to get less growth and exploration of the learning.
On occasion, a couple of you have come to me to consult about things like this that might happen, and my door is always open to be able to talk about issues like that. But I remember Iris and I talked about some students that were openly laughing at another student, and it wasn't just one time, it was a pattern. And, I had said to her at the time that I really would talk with those students, not in front of everyone, but I would start a dialogue with them about that and what that meant, and hopefully bridge some empathy, because I think that that's really important if we're going to be inclusive, is that we have to take an empathetic stance. So part of us helping to socialize our students is to help them be inclusive to different ways of being. And so I would start a dialogue with students who are doing that to help them think more empathetically toward difference. Okay, question 3. How can we as instructors best help our ADD, ADHD, and students with autism in the classroom? Communicating with these students seems to be the most difficult. What is the best way to handle the student when you have a gut feeling that things are not right, but the student does not want to discuss things with you? So the first question seems to be about communication, and the second seems to be when you have a student who might be resistant to talking about some of the things that you're seeing.
It's awfully hard to know what somebody's diagnosis is, just by looking at them. Especially somebody who's in this question reserved, Unfortunately, the people who are totally well-behaved are people who get the least amount of attention sometimes, so you kind of don't reinforce it. But I do think that, you know, if something is very evident, then in these two cases, I would probably try to figure out a way to impose just a little bit more structure. A lot of times, lecture time is pretty unstructured, and you know, maybe that person might benefit from a specific structure. You could even approach the student and say, look, I've been noticing that you're kind of struggling figuring out where things are, and just kind of impose some structure for that student about, okay, how about you do this? Maybe in 50 minutes into the class, you ask a question. Just figure out one from the chapter, or you know, something like that. Just make it up, but make it where that person feels safe. I think that was something that Dr. Ketnes referred to, and that is absolutely of the utmost importance to all of our students.
There's a really good resource. Mass General Hospital has a website that they call schoolpsychiatry.org. I'll say that again because I think it's a great website. It's Mass General Hospital has it. I always just do schoolpsychiatry.org and I get redirected. But it essentially is a website that is developed to how different mental health issues affect kids in school or adults in school. And it has stuff for teachers, for parents, for clinicians. It has different rating scales. But one of the things it talks about are different interventions that can be helpful for various different diagnoses. And it has been, and again, not every intervention or recommendation is going to be useful for every individual, but you probably can see a number that you think might be helpful or effective. And I think it's, again, I think it's really well organized. It's got a lot of different tools, and I think if you're pondering a lot of these issues over and over, this would be a really good place to get resources or to get ideas.
Okay. Question 4, and you'll notice that a lot of these have similar themes. I tried to put the questions together that were similar, so not all the questions are about spectrum disorders and things like that, but I tried to put the questions together at the beginning that related to what we call autism spectrum disorders. So if a student displays autistic tendencies, how do you continue to engage that student without impeding the education of others? Specifically, what are some methods for convincing, and I would say a student with autism, who is fixated with a problem to move onto the current topic in a definitive but kind manner? What are some methods for encouraging a class to be patient when a student violates various laws of the classroom? What do you think, panelists?
I think sometimes if it's happening on a repeated basis, having a discussion with that student, and sometimes doing it in writing potentially, because I think one of the things that tends to be a strength for people on the autism spectrum is verbal understanding or talking about what's going on. So if you're trying to communicate not verbally with looks or gestures, it might not come across to the same degree. And so I think it's okay to say, when I'm saying this or when I give you this look, this is what I'm trying to say. And sometimes what I'll do is if someone has a very specific subject they're very, well knowledgeable on, I can, maybe you can come up with a code word of when I say this means like, I want you to push the pause button, or I want you to stop, or something, so that you can give them a verbal cue that you need to switch gears. Because sometimes I feel like the way we're trying to do it isn't working. And again, I think sometimes, people have ways that already are working for them. So talking to them about what would be helpful. Because again, when that individual comes up with a solution, or they come up with it with you, they're going to buy into it. I use the electronic stuff a lot. I'll say, I want to rewind, or I want to pause, or I want to push the stop button here. Like, I want to cut off, I want to switch videos or something, whatever. But it's a way that it's very clear what you're trying to get across, and it's not doing it in a gesture or a look or a non-literal way, because sometimes sarcasm or humor isn't well picked up on. And so I think it's easier if you just say it clearly what you're asking for, as opposed to talking around it, but saying it respectfully.
Yeah, I really like that idea, and creating a feedback loop with the student. So being able to experiment with things and then checking in with them. Hey, when I cut you off after class, when I cut you off there, did you understand why I did that? Where are we at with that? I think being able to continue to engage in conversation with that student to find a place where it works for everyone is important. I think For me, a thing not to do is just to keep coming to class after class and cringing and hoping it's going to stop and then getting angry or whatever your emotional response is. For me, I would rather try to find a way to communicate and find a compromise and a space to work together than to start to dread the class or the student or something like that, which is not healthy for anyone.
Another thing, and this is a bit tangential and it may be more applicable to someone with OCD, but I think engaging the student by maybe giving them an assignment. I was privileged to take a Spanish course here about 3 years ago, and at that time, at least, the professor always took attendance in the beginning. I don't know if that's something a student or maybe different students could read that list daily. Or to notify, could you notify us when the class is half over or when we have 5 minutes left? Those, for me, that would have been helpful. I never did that with a student in my class, but that would have been helpful. In trying to include the student and give them a focus of something that they are responsible to help with.
Similar to that, something that I used to do, I think, since 3rd grade to help with me not cutting people off or not interrupting the class, depending on if I do it or when. I sometimes look at the clock and then see how many minutes left there is in the class. Then I use powers of 2, 120, 64, 128, 256 minutes left, and then I figure out how many minutes until the next half point. And I keep doing that, and it actually distracts me well enough that I can both pay attention to class and not do not disrupt it in the same way. That might be able to work with other people. I don't know if that's me specific, but that might.
All of these things kind of go back to what I mentioned in the last question, which is particularly for people with autism spectrum disorder, imposing some type of structure. I mean, these are people who were in high school maybe just a minute ago, right? And high school, you know exactly where you're going to be, you know exactly what you're going to do, with the exception of the lunch period that's a little bit chaotic. You pretty much know what's going to happen, and then you get on the bus, and it takes you exactly where you're going to be, and you know, I mean, within 5 minutes, you've had the whole day planned out. Then you start college. I mean, nobody even cares if you go. You know, how did you get there? So everything is just a total chaos. And sometimes this person, hey, I know this stuff. I just read the chapter. This guy just asked a question. I know every answer. I'm going to tell him every single answer. You know, so at that point, maybe you just need to impose a little bit of structure that and I agree totally with Dr. Ketnes in terms of it can't be just sort of vague or I had a client, this was a number of years ago, every time he came up to anybody, he would start every conversation with, "Are you mad?" And I was like, wow, I just got here, you know? But to him, it was a way of figuring out, because he never knew. He would be around somebody, and somebody would get mad, and he had no idea if somebody was mad. So it was just easier for him to just figure it out right away. And most people, frankly, also were kind of disarmed by it. And whether they were mad or not, they'd be like, no. You know? So at that point, he gets the answer he wanted. But the point being, basically, that you do need to be fairly direct. You do need to be, it really does need to be a structure. And for a person with autism spectrum disorder, one way to impose structure is simply, you know, talk to this person and say, here's the deal. You do know a lot of different things, and you're very valued in this classroom. I would appreciate it if you would raise your hand, or maybe have that for the whole class, so you're not sticking, you know, having him or her be set aside. But it really just figuring out some way where it's not just the chaotic classroom environment with everybody just kind of chiming in at will, which that's kind of my style. I like to instruct that way. If that's your style, then maybe for that class you need to adjust that.
And to be able to elicit from them, I think, as well as Cypress reminds us, what worked for them in high school, what worked for them in any kind of other educational experiences that they've had, so that they can remember to employ those strategies in a classroom that does seem to have less parameters and less structure than maybe where they came from. This question is also similar, but our last one in spectrum disorders, I included it as a separate one because I thought it would be interesting to talk about how to help students with autism when they're in group work or in a class discussion? Are there specific strategies that help in those two forums? No.
Well, I hate to be the one-trick pony, but you know, just you have to figure out. Basically, it can't just be some wide open. There is no structure to this. You know, particularly for people have that diagnosis, they just need to have a basic understanding of what the boundaries are, because boundaries are one of the primary issues, and it's not all about maladaptive behavior. It's simply trying to figure out where I belong on this topic of this assignment. And so if you anticipate that, then probably your class discussion or group work needs to anticipate that as well and be a little bit planful on the instructor end.
Right, so advanced planning, giving them an outline at the beginning of class, allowing them to see the questions, encouraging them, why don't you take notes, but you may not answer every question, but you definitely can write down every question. We know, especially with attention deficit disorders too, advanced planning, having that structure, then being able to see it at the beginning of class and participate, not always orally, but by able to write things down really helps as well. So planning in advance with them and thinking about how they can be included, not always verbally, and then also for them to see what your long view of the discussion looks like, what your questions are, what's expected of them, helps that advanced planning piece that you talked about.
I think it also goes beyond just the person with autism. It also goes to the other students as well. Not in a necessarily fixable way, because there's an element of uncanny that happens when someone is different to a certain extent, and that's not easily fixable. I'd say the easiest, the best way to actually help with a group project, the most successful I've ever been in when someone has a disability, comes when you are working together but have, I don't want to say it, but probably the least communication involved. When you are just sharing answers, sharing small thoughts between groups, is probably when the most effective communication can go. Because when people are actually have 2-3 sentence explanations, the person with autism normally keeps quiet, if not shuts down.
My guess is you actually are going to have a lot of shy people in your class, a lot of people with social anxiety, and the group projects are going to be difficult, or speaking up in class. And those individuals, I think, really under-voice their needs. They don't ask for the resources that might be beneficial. It's very difficult for me to get someone who has social anxiety when they have testing anxiety at times to request testing in a quieter environment or time and a half. So I think those are individuals that, again, they're not as fixated or interrupting in times, but again, I think they are very easy to get lost. And my concern for those individuals is that they're going to underachieve or under-advocate for themselves or believe that they can't do it. So I think, to me, some of it's going to be sort of strategic about how you decide to put certain groups together. And I think, you know, some people do better with conceptual learning, other people do better with sort of information or data, and you're going to want to try to balance out and know some of those strengths and weaknesses. And so I think, in some ways, I should say a lot of people do really well because this is the most familiar setting, is to be in the school setting, because that's the one they've been in so long. I think it's very challenging because the amount of self-initiative and motivation that's required to be in college is big. And they're not just doing that in college, they're doing that in many other roles in their life. So there's just a lot more stress. And so I think, to me, you might just be seeing more of it in the school setting. But it's about being understanding and trying to play to people's strengths. And if someone's talking too much, you might want to work on how they're going to be a little bit quieter. And the people who are quiet, you want to work on them being a little bit more talkative. And so it's about, you know, it's not that one is good and one is bad, it's about having a healthy balance.
One thing that I think is also easy to overemphasize is that somehow this person is fragile as an egg and you can't do anything to harm this person, and anything you say is going to freak them out. Because frankly, if you have a person who's 22 years old 19 years old and is very disruptive in your classroom, I can guarantee this is not the first time. You know, this is not the first time this person has been disruptive. This is not the first time this person has been in trouble for it. If you go and address it with them, they're probably, that person's probably not going to be super embarrassed by it because it's something like, oh, here we go again. But if you can address it in a way that's respectful, that's always appreciated by anybody. And so I certainly wouldn't suggest that people just think, well, this person has this diagnosis and I really can't intervene because it might hurt this person's feelings. It's more important than that. And it's not that you're all clinicians who are trying to fix people, but you are preparing them for life, you know, and going out in a job. If they do this, that's going to result in bad things. So addressing it in some way is very important, and I wouldn't be overly concerned that the person's going to be freaked out by having it be addressed.
I would like to, I don't know how helpful this is, or how, this is probably a fairly common thought, but anyways, college is more than just a place of education. It's also a place of social learning, where you get to know how you can and cannot act. So if you are too afraid of how someone may react to something, it's not like everything will be okay with for them if they get their degree and go past this point. They will run into the same problems they're running into now, except it'll be within their career, not in the safety of a classroom environment. And at those points, it may cost them their jobs. It may cost them more problems than just a uncomfortable conversation can afford.
That's well said.
It's just
I have,
excellent.
oh, sorry, go ahead, please.
I think that it hits it. So, right on the, the group work is frustrating. And nursing students, we have a lot of group work. Students want to get a good grade, and so-and-so is not contributing, and it's going to affect my grade. So that relates, though, to the fact that, again, you may be working even with that very person in the future. And so to help them appreciate that point. And there's an old method, participation training, which has a tenet of shared leadership and collaboration about the quiet student. That sometimes the more quiet ones have the best ideas, but one little way is to have, when they meet for their projects, a different leader each time, and that everybody is required to throw out an idea. You know, it may just be a wild idea, but everybody has to say something so that everybody participates at least a bit. And then, of course, encouraging the group to stay in communication. If somebody misses a group meeting, you don't just ignore them and leave them out of the loop. It's your responsibility to reach out and, at least in an email, or let them know when the next meeting will be.
Thank you. I have 17 questions and 8 minutes. I'm gonna move on to a different topic. I particularly like this question. Are there any true ways to help students with test anxiety? We're not allowed to talk about the false ways. We're talk about the true ways. Are there ways to help students with test anxiety? Of course. Yeah. What would we say?
Deep breathing. Ask everyone to take at least the 3 deep breaths in the beginning. If you really do that, you're distracted a little bit from, I have anxiety, and I think if I remember to do that, or if somebody tells me to do it. Now, I don't want to have to go through some meditation thing. We had one instructor that did that before class, and that would make my anxiety go way up. But the 3 deep breaths I could deal with. I would be able to deal with. That's just my one little thought.
Yeah, I think if a student comes to me and says, I have test anxiety, my first question to them is, you know, how long has this been going on? What have you been doing to sort of work with that? And I might talk with them about, you know, you might consider talking with someone here a couple of times to learn some strategies. I don't ever enter into the psychologist role with my students, but I definitely will tell them, hey, you can go talk with someone for a couple of sessions, and there's a lot that can be done to help with anxiety in general and test anxiety. So I refer them to our services, even if it's 1 or 2 sessions, so they can learn those strategies and practice them.
Also, I'd say that, even though this is a bit strange, I think test anxiety is a bit vague, in the sense that some people have anxiety over different things. I've even met somebody who actually has anxiety over being in a room that's silent. So if they're in a room that has a test going on, they can't really function. They are having test anxiety, but it's not over the test, it's over the rest of the room. Some people don't like being in a room with a bunch of people that might be part of test anxiety, because people don't show up to his classes often if they're not having a test. You'll find that his room sometimes has 10 extra people that you didn't even know exists in the class when a test is going on. But there's also, there's many different ways that people can't have anxiety over tests, so there's never going to be one universal fix.
As a person who has that, I'm a process thinker, so I'm always the last one to turn in the test, or one of the last. And for me, the classroom makes me nervous, and if I sit in a corner, that helps me better. Because if I sit in the front and people are passing me, turning their papers in, I'm disrupted every time and anxious. How much, am I going to get through? But having that structure has always been helpful to me. I don't know if you have the policy here, but at IU, if a student was declared through the disabilities office, they could have a test given, you could give it elsewhere in the professor's office, or people that had that job to give them a test elsewhere. That's a bit extreme, but for some people that was helpful.
And I threw up this question because it relates, we do have, as you all know, services related to that, but what if you have a student that has anxiety but hasn't gone through our services? But during the test, you can see maybe they're panicking, as you can read the description up here, or they're very, very anxious, but they haven't or they won't go through our disability support services. What would be some options?
One thing that, and I haven't done this personally, but this is how I would address it. I haven't had a student who approached me and said, I have this really big problem. But if I did have it, the first thing I would do is I would meet with the student to discuss preparation. And I'm not suggesting that all test anxiety is just poorly prepared students, but there are a lot of people out there who don't really know how to study, and then they do poorly on tests, and then they basically attribute that to, I have test anxiety. It's like, well, no, you have bad preparation skills. And so the first thing I would try to do is I would try to address it with preparation, but as an adjunct to that, I would also look at, if you look at the gold standard treatment, and I'm not trying to treat my students, but if you look at the gold standard treatment for any anxiety disorder, it's really about repetition of, exposure therapy. And so one thing that you could do for a student who had test anxiety is give them some practice questions. They're not going to be the same questions you're going to see. They might even be on a different topic. Who cares? You can see this is the kind of question I'm going to be asking you. Or, all of us probably have pools of questions. There are a lot of questions in that pool that I'm never going to ask. Well, that would be good fodder for try these 10. Give them a chance to do a page of questions 3 or 4 times, and then when they come into a test, then they've got some practice, and you've already talked to them about preparation, and at the very least, that should help.
I can definitely relate to what he has to say. I severely suffer from test anxiety. One of the things for me was learning how to prepare myself for that test the correct way. My classes prior to getting into the respiratory program, a lot of what we were learning in anatomy were just repetition. It's memorizing. So when I got into the program, it's not just about memorizing. You have to convert it and know what you're going to take the test over the next day. So I made study guides based on notes that I took from class. I would make study guides. I'd make 10 copies, and I would do those study guides over and over and over until I knew exactly how to answer those correctly. Then I also chew gum during the test. I don't know if that's proven to help, but I do chew gum.
Same flavor.
Yeah, I like it. I don't know if that helps, but I do chew gum.
Before we turn to you all for questions, the last set of questions really has to do with students that may have some kind of psychological issue going on, but have not sought out services. And I'm reminded a little bit of what the panel has said, that we really can't diagnose someone, nor should we, in the classroom. I definitely, for me, would have a dialogue with the student about what's going on for them. I would ask if they have sought out support. If they haven't, that's their choice. They're not required to go through our services. And even those people that have, they don't have to take those accommodations if they don't want to. And so I would see where they're at and work with them where they're at. And I think there can be some flexibility about that, but a lot of the questions were about what if something's undocumented and they won't go to services, and that is their choice, whether they will or they won't. Last question I was going to throw up here. I have students who sometimes ask about whether there are counseling services for them. So I just wanted to show you. Thank you, Bill. Where are you? There's this thing called the snipping tool. I know you already are all well aware of it. On Campus Connect, you can direct a student, and this is what I do if I refer a student to services. I will tell them to go to Campus Connect, and there is a link right here to our counseling and psychological services. So it's about midway down the page on the right-hand side. Doctoral students from Indiana University come and offer their time. They're supervised by IU through a place called the Center for Human Growth. It's completely free for our students. It's an outstanding service, and I always tell students there's no other time in your life you will get free counseling services. And so I have brochures in my office, but I also just tell them you can go and click on that and call, or you can do an online form, and then they take it from there. But that's where they would access that, is off Campus Connect. Okay, I think you're up. What kinds of questions did you all have that came up for you, or follow-up questions that you have? You have to make Dr. Connolly run around the room. None? Oh, come on.
Thanks. I did have a follow-up question regarding the test strategy, right? So in this situation where a student is exhibiting some symptoms here, specifically, what should we do?
You mean during the test?
Yeah, like, so the test is happening, this student's breathing heavily, red face, says, oh man, this is a real issue that I have, but they haven't, went to the office previously.
Well, one thing I would do is I would go up to that student and I'd try to be as calm as possible, and I'd say, you want to know what? I realize that you only have an hour, but I don't care. I'll give you a little bit of time. Sure.
That's the greatest thing. That would have helped me. I was sometimes chasing a history professor. I was chasing him down the hall with my paper because I had to say everything I knew, not just what the question asked.
Yeah, I had that happen with a student, and she asked me to come out into the hallway, and she was upset. And the first thing I did is said, let's walk down to my office. So I wanted to get her out of a private place. It doesn't feel good to have a panic attack in a hallway as people are walking by and staring at you. And I did not enter into psychologist mode, but I definitely just talked with her, and she calmed down, and then we figured out a better time for her to pick up the exam. And then she went to talk with someone here after I had talked with her and said, why don't you go and talk with someone for a session or two and then come back to me and tell me how it went. And so I talked with her and scheduled another time for her to take it when she felt more calm.
I usually think about if someone's having a panic attack or they're super anxious, they're in fight or flight mode, right? So I always use the analogy as they're really a tiger in the room. And it's a false alarm. And I get that, but part of the acute situation is to bring them back to Earth because they're on another planet. What you would do in the long term about test-taking anxiety would be a different issue, I think. So to me, it's the acute situation. And one thing I think is really important, and I think is nice to emphasize to students, I don't think it's as often thought of in the States, but part of our learning is falling down and not always answering questions well. I mean, most of what I remember the best is the stuff I've missed on tests. So it's not that, and as long as it's not catastrophic or life-threatening or really damaging, those are important things for us to experience and learn, and that's part of our growth. It's hard when we repeat the same thing over and over again, and yet we're not picking up strategy. So that person, when they're calm and you said, you know, how often are you having these sorts of things happen during tests? If it's a one-time thing, that's very different than it's happened for the last 3 years. Because if it continues to happen and the way you're approaching it is to ignore it, then that doesn't help the situation.
Well, and also, if you allow a student who's having a panic attack to basically escape that panic, you've reinforced panic. And so if you can get that student in vivo to kind of get to where, I use the Tigers in the gym. If you can get somebody to kind of sort of calm down and get to where they were able to actually get through it, then at the end of the day, maybe they didn't get 100%, they probably didn't, but at the end of it, it's like, well, it wasn't so bad. Whereas if you panic and you bolt, all you're telling yourself is, that was a dangerous situation, that was scary, and you've reinforced panic, and that this is kind of the exact opposite from an anxiety, if you were doing therapy, from what you would do in a therapy session.
I think you answered it. For me, I was going to ask, is it curable? So I've had students tell me I have this anxiety, can it be fixed?
I usually talk about general volume, and I never promise that I'm going to stop someone from ever having a panic attack again. Because they do it's not the panic, it's the fear that it's going to happen again and they're going to lose control. And no, it can happen again. And there are times I say, I want you at times to feel scared, because there are times in life where it's perfectly normal and physiologic to have that sense of fear or terror. It's when it's a false alarm. And so it's how to be more strategic about handling false alarms. And most of mental health disorders are not curable. Most of them could be managed more effectively. Just like I would say like asthma or diabetes. And I usually talk about it like you get dealt a certain hand and you want to be skillful about how you play your cards. And you're in certain classes, you're taking certain subjects, and it's not always about that you're going to be the star student, it's about how to be strategic. And I do have to say, one of the things I think students don't understand is missing work gives you like an F almost automatically. And so lots and lots of people I see think that they're horrible in school, maybe they had learning disabilities or math LD, or they have ADHD and they think they're not a great student. And the issue is that they have too many missing assignments, that there's no way mathematically possible that they can get the F out of the gutter. And so I think sometimes their interpretation of why they're doing poorly doesn't really match why they're doing poorly. Because missing work, I do this problem over and over again, because there's no amount of hundreds you can do to get yourself out of an F after a certain period of time.
Nobody's looking for cures, frankly, because you're not going to find them. But what you can find is somebody who has an anxiety disorder. They're meeting certain criteria based on like the DSM, and they can get to where they're no longer meeting the diagnostic criteria for anxiety disorders. But that person's probably always going to have some level of anxiety. And what you really are looking for is, at what point are you functioning well? I mean, that's the whole key to any kind of counseling or clinical intervention. It's not curative so much as coping.
Yeah, I guess we don't say cure in mental health too much, but it's the same thing as someone would come to me and say, oh, I'm introverted, I'd like to have that part of my personality taken away. It's not possible. It really is more embracing and getting to know that and working with that. Maybe you'd like to be a little more extroverted in these ways and then learn to appreciate that. And so we don't talk cure. I think we just talk getting it to a manageable rate while also understanding you could be sort of an anxious person, and that's okay,
Also, I would like to, I'm no professional in this in any way, but in the same way that people may have panic attacks or anxiety disorders over varying things while taking a test, I would also say that they could have anxiety disorders over varying reasons during a test. And I think that a lot of the times that people are having a panic attack during a test is they're afraid of having something that they're thinking being reinforced. Either they don't want their teacher knowing that they don't know material that they didn't study, they don't want to justify or validate their ideas that they are not as smart as they thought they would be growing up. It's too varies too heavily to be able to be really cured or even really fixed to a degree. But if someone has something, possibly talking to them, seeing what's wrong, afterwards may do a world of difference, because if you can figure out if they were bullied as a kid because they didn't have a high enough test score and they didn't get the green frog on the wall, then that might actually show why they are doing that now.
I think too, if you look at one of the reasons our students say they don't seek services, it was because I'm concerned what other people are going to think of me. So there is a stigma associated for some people with seeking out services. And so the more I feel I normalize that as one tool you can use in your life, similar to going to a doctor or yoga or whatever it is that any of us do, the more we normalize it, the more we decrease the stigma. And the more it doesn't become about, I'm concerned what other people are going to think of me, because it is one tool that people could use to address issues that are coming up for them.
I'd like to say, as a proactive intervention, I have found as the teacher, but as a student, very helpful to have students that have been successful students that have been through that class or that program talk. And I did that with sophomore students who have the senior students come and talk. But as a student myself recently, talking to the people that had successfully gotten through the program and with the courses and what did the papers and what was it like, and I think that is very useful. And also, on that same vein, if you have classes where this would apply, I taught psych nursing, so I had individuals from the community come in with disorders who were willing to share their experience. They were exemplary people who were successful and functioning. But I think that was always the highest rated thing on the end of the year survey. They loved having people from the community come in and talk. They were out there functioning. It was different from the clients they saw at the hospital or elsewhere. These were real people functioning and who would answer questions and come to the university campus and tell their story, and that was extremely helpful. Reducing stigma.
Yeah, I think our SI program could do that a little bit, and what we're trying to think about in the retention committee and things like that is having successful students come back and assist other students is a great model for that we're trying out here. We have time for another question.
Do you have any advice for those of us who teach at the regional campuses where there are no services? I often have a student come to me with a piece of paper with, and there's no way that can be done, any of it, because there's nobody in the building most of the time except me.
I think it's really good to find out where your community mental health center is, practitioners in the area that are willing to work pro bono or have sliding scale fees so that you did know what's available to students in the area.
What I really need to know is how do I help a student right there in that classroom? I mean, I have a brochure with all the community resources, but they are not in that building. And my students do not drive. They take the bus or a friend drops them off. So to tell them to go to Bloomington for anything is useless. It's useless. And in this building, again, there's no personnel from Ivy Tech except me. So when they hand me the paper, all I can do is look at it and pat them and say, if you do your best and I do my best, we'll get through this. And so far it's worked, but the time is going to come when it's not going to be enough. And I worry about it all the time because I feel whatever happened would be my fault.
Okay, it's not like therapy, but I'm involved in 2 support groups. One of them, Depression and Bipolar Support Alliance. It's a national group. And I have a flyer, and I'd like for you to have with the national website. They do have online groups, and it says depression, but many of the people in the groups also have anxiety. And it is a way of some communication. And I think, and one more thing kind of related, if there's any concern about safety with a student in regard to are they going to hurt themselves, I think we should all know and write down the number for the national hotline for that. The 1-800-273-TALK. 273-TALK. It really works 24 hours a day, and that all of us should have that written down so we have that ready to give students if they need to talk to someone in the middle of the night or anytime.
Yeah, it sounds like a lot of the responsibility you feel is on your shoulders. And I think it's important to show them too the support that they can seek out. It's not all your responsibility either if they succeed or fail, but they can also seek support when or where it's available, be it a hotline, be it a resource, things like that.
Our biggest problem there so far has not been depression or anything, it's been anger. Severe, scary, creepy anger issues.
We haven't talked about it in the panel, but one of the things that increases dangerousness in this age group, in the sort of late teen, early 20, is the substance abuse. And that's actually really challenging. But I feel like one of the things that makes them more risky is it affects their judgment, and it potentially can make them do things they wouldn't do in any other situation. So it's one of the reasons, for example, the suicide completion rate has been going up, is because substance abuse is more prevalent, the drugs that people are using are stronger. So it's a very high-risk age group. I think it's also, one of the things I like to think about is sometimes, as much as you want to help someone, if they don't want your help, you can't fix it necessarily, or fix what's going on. There's always emergency services. There just might not always be services that in the long term are more effective. So you can get the police to come, you can get an ambulance to come. It's harder to get things that in the long term are going to be as effective. And that there's a dearth of services, it's hard to get. But I think it's important to think about, we do what we can. Some people are not in a place or in where they are able to be helped, and that's very hard.
Well, even if somebody gets an ambulance ride, and it could be from Bedford or from anywhere to the Bloomington Hospital, and they end up on the 5th floor, that's like 5 days. That's not necessarily a long-term fix for what their problems are.
And this is my job as the moderator to say that it's 2 o'clock. I want to thank our panelists very much, and all of you for your questions. I'm sorry that I've cut us off, but I know you have other presentations.